to breathe deeply. Feel yourself becoming calm and centered. Today we're going to talk about managing oily skin calmly, without frustration, without harsh treatments, with understanding and gentle effectiveness. If you have oily skin, you might feel like you're constantly battling shine, dealing with makeup that slides off, or worrying about your appearance throughout the day. But here's an important reframe. Oily skin is not bad skin. It's simply skin that produces more sebum than other types. And oily skin comes with advantages. It typically ages more slowly, develops fewer fine lines, and maintains moisture better than dry skin. The key to managing oily skin is working with it, not against it. Harsh stripping treatments that remove all oil actually trigger your skin to produce even more oil in compensation. A calm, gentle approach that supports your skin's balance works far better. Let's understand why skin becomes oily. Sebaceous glands in your skin produce sebum, an oil that protects and moisturizes. Some people's glands simply produce more than others due to genetics. Hormones significantly influence oil production. Androgens increase sebum production, which is why oily skin often worsens during puberty, menstruation, pregnancy, or times of hormonal change. Stress increases cortisol, which can trigger more oil production. Dehydrated skin may overproduce oil trying to compensate for lack of moisture. Harsh cleansing strips oil, triggering your skin to produce even more. Understanding these factors helps you address them thoughtfully. The foundation of managing oily skin calmly is proper cleansing. Use a gentle gel or foam cleanser formulated for oily skin. Look for ingredients like salicylic acid, which helps regulate oil and keep pores clear. A concentration of 0.5 to 2% is effective without being harsh. Cleanse once daily in the evening. This might seem insufficient if you're used to cleansing multiple times per day, but over-cleansing backfires. When you strip away all oil, your skin panics and produces more. One thorough evening cleanse removes the day's accumulation without triggering overproduction. In the morning, many oily skin types can simply rinse with lukewarm water. You haven't accumulated much oil overnight, just a light protective layer that's actually beneficial. If you feel you must cleanse in the morning, use your cleanser very briefly, or just apply it to your T-zone. Use lukewarm water, never hot. Hot water strips oil aggressively, damaging your barrier and triggering more oil production. Massage your cleanser gently for about 60 seconds, then rinse thoroughly. After cleansing, resist the urge to skip moisturizer. This is crucial. Oily skin needs hydration. Oil and hydration are different. Your skin produces oil, but it still needs water. When properly hydrated, your skin actually produces less oil over time. Choose a lightweight, oil-free, non-comedogenic moisturizer. Gel or gel cream formulas work beautifully for oily skin. Look for ingredients like hyaluronic acid for hydration, niacinamide for oil regulation, and glycerin for moisture retention. Apply moisturizer to slightly damp skin morning and evening. This seals in water and supports your skin's barrier function. Within a few weeks of consistent moisturizing, many people notice their oil production decreasing. Sun protection is essential and doesn't have to make you oilier. Choose lightweight, mattifying sunscreens formulated for oily skin. Gel sunscreens absorb without residue. Many mineral sunscreens with zinc oxide have a slight mattifying effect. Some chemical sunscreens are extremely lightweight and invisible on the skin. Apply sunscreen every morning after moisturizer. The right formulation won't increase shine and will protect your skin from damage and premature aging. For oil control throughout the day, use blotting papers rather than washing your face repeatedly. Blotting papers absorb excess surface oil without stripping your skin or triggering more production. Keep them in your bag or desk for quick touch-ups. Carry a lightweight, oil-free moisturizer for midday if your skin feels dehydrated. Sometimes what feels like excessive oil is actually your skin compensating for dehydration. Setting powder or mattifying powder can reduce shine if you wear makeup. Look for translucent, non-comedogenic formulas. Apply lightly to oily areas, T-zone typically, using a fluffy brush. Incorporate oil-regulating ingredients into your routine. Niacinamide at 5% concentration helps regulate sebum production over time. It's gentle enough for twice daily use and provides multiple benefits: oil control, barrier support, and reduced inflammation. Clay masks once or twice weekly help absorb excess oil. Use masks with kaolin or bentonite clay on your T-zone or entire face. Leave on for 10 to 15 minutes, rinse with lukewarm water, and follow with moisturizer. Salicylic acid treatments 2 to 4 times weekly help keep pores clear and may help regulate oil. Use a leave-on treatment with 0.5 to 2% salicylic acid after cleansing, before moisturizer. Retinoids can help regulate oil production and improve overall skin texture. Start with over-the-counter adapalene or ask a dermatologist about prescription options. Use them slowly at first, 2-3 times weekly, and always with adequate moisturization. Now let's discuss lifestyle factors that affect oily skin. Manage stress, which directly increases oil production through hormonal pathways. Regular exercise, meditation, adequate sleep, and stress reduction practices all help regulate your skin's oil output. Stay hydrated internally. When your body is well hydrated, your skin can better regulate its moisture and oil balance. Drink water consistently throughout the day. Evaluate your diet. Some people find that dairy or high glycemic foods increase their oiliness. If you suspect a connection, try eliminating these foods for a month and observe whether your skin improves. Get adequate sleep. During sleep, your skin repairs and rebalances itself. Chronic sleep deprivation can disrupt hormones and increase oiliness. Don't touch your face unnecessarily. Your hands transfer oil and bacteria, potentially making oiliness and breakouts worse. Keep everything that touches your face clean: pillowcases, phone, makeup brushes. These can reintroduce oil and bacteria to your skin. Be patient with your skin's adjustment period. If you're transitioning from harsh, stripping products to gentle care, your skin needs time to recalibrate its oil production. This typically takes 2 to 4 weeks. During this time, your skin might seem oilier than usual. Stay the course. It will balance. Let's address what not to do for oily skin. Don't use harsh, stripping cleansers or alcohol-based toners. These feel satisfying in the moment, that squeaky clean sensation, but they trigger rebound oil production. Don't over-cleanse or over-exfoliate. More is not better. Excessive cleansing and exfoliation damage your barrier and increase oiliness. Don't skip moisturizer and sunscreen thinking they'll make you oilier. The right formulations won't increase oil and are essential for skin health. Don't expect instant results. Oil regulation takes weeks to months of consistent, gentle care. Accept that some level of oil is natural and healthy. You're not aiming for completely matte, oil-free skin all day. That's neither realistic nor necessary. You're aiming for balanced skin that doesn't produce excess oil. Consider professional help if needed. If your oily skin is severe, causing significant acne, or not responding to home care, a dermatologist can offer prescription treatments, stronger retinoids, spironolactone for hormonal oil reduction, or other options. Remember the advantages of oily skin. You'll likely age more slowly, develop fewer wrinkles, and maintain better moisture than people with dry skin. Your natural oils protect your skin. This is a feature, even if it sometimes feels like a burden. As we close, embrace this calming truth. Oily skin can be balanced through gentle, consistent care. Stripping and fighting your skin makes things worse. Supporting and working with your skin's natural processes brings lasting balance. May your skin find its natural balance. May you manage your oily skin with calm and patience. May you appreciate the benefits your skin type provides. Thank you for this time together. Manage your oily skin calmly, gently, and effectively.
Layer of moisturizer. Some people find using a facial oil, just a few drops, over moisturizer helpful for managing dryness, though oils can clog pores in susceptible individuals. If oil worsens your acne, skip this step. Peeling and flaking occur frequently with chemical exfoliants and retinoids. Mild peeling indicates exfoliation is working. However, severe peeling suggests your treatment concentration or frequency is too aggressive. Manage peeling by reducing treatment frequency. Use 2 to 3 times weekly instead of daily. Reducing concentration. Switch from 2% salicylic acid to 1%, or using shorter treatment durations. Don't pick or peel flaking skin manually, as this damages your skin barrier further. Instead, gently pat moisturizer onto flaking areas and allow them to shed naturally. Redness and irritation are common initially, particularly when starting retinoids or high-concentration treatments. Mild redness that resolves within a few hours is normal. Severe, persistent redness suggests your treatment is too strong. Reduce frequency or concentration. Use the sandwich method to reduce irritation. Apply soothing products like aloe vera or Centella asiatica. If redness persists despite these measures, discontinue the treatment temporarily and consult your dermatologist. UV sensitivity occurs with retinoids, chemical exfoliants, and some other treatments. This doesn't necessarily mean you'll burn easily, but your skin is more susceptible to sun damage. Use SPF 30+ sunscreen daily, reapply every 2 hours if outside, and seek shade during peak sun hours. Wear protective clothing and hats if possible. This is non-negotiable when using photosensitizing treatments. Purging is temporary worsening of acne when starting certain treatments, particularly retinoids and strong exfoliants. Purging occurs as the treatment brings impurities to the skin's surface and accelerates cellular turnover. Purging is usually a positive sign that your treatment is working, though it's unpleasant. Purging typically lasts 1 to 2 weeks but can persist up to 4 weeks. If purging lasts beyond 4 weeks or becomes unbearable, discontinue the treatment and consult your dermatologist. Contact dermatitis, allergic reaction, to products appears as itching, rash, or swelling. This is different from typical irritation. If you develop contact dermatitis, discontinue the product immediately. Identify the specific ingredient causing the reaction and avoid it in future products. Common allergens include benzoyl peroxide, sulfur, and certain plant extracts. Hormonal side effects may occur with spironolactone or oral contraceptives. Dizziness, lightheadedness, menstrual irregularities, and breast tenderness are possible. Report any concerning symptoms to your healthcare provider. Regular blood tests ensure your potassium levels and kidney function remain healthy if taking spironolactone. Sensitivity and compromised barrier function result from overuse of strong treatments. Your skin feels tight, uncomfortable, and is reactive to previously tolerated products. Manage this by stopping all actives temporarily and using only gentle cleanser, hydrating moisturizer, and sunscreen for 1 to 2 weeks. Allow your skin barrier to repair. Then gradually reintroduce treatments at lower concentrations and frequencies. Building tolerance to treatments requires patience and gradual progression. Start conservatively and increase gradually. This approach takes longer initially but leads to better long-term outcomes than aggressive starting that causes severe side effects and treatment discontinuation. Remember that slow, consistent progress is preferable to fast progress interrupted by side effects forcing you to quit. Guide 19, the Complete Long-Term Acne Maintenance and Prevention Plan. Once you've achieved clear skin, the challenge becomes maintaining clarity. Many people achieve clear skin only to abandon their routines, resulting in acne recurrence. Understanding long-term maintenance prevents this cycle and keeps your skin clear indefinitely. Continue your core routine indefinitely. The Cleanse, Treat, Moisturize, Protect routine that cleared your acne remains essential for maintaining clear skin. Don't abandon these steps thinking they're only necessary while acne is active. Your skin's tendencies haven't changed. Stopping treatment allows acne to return. Identify which specific treatments worked for you and continue them. If salicylic acid was crucial to your success, continue using it at maintenance levels, perhaps 2 to 3 times weekly instead of daily. If retinoids were essential, continue them nightly or at whatever frequency you use successfully. If benzoyl peroxide was key, continue it. Maintenance doesn't require the aggressive frequency you may have used during active acne treatment, but it requires continuing the treatments that worked. Simplify your routine for maintenance if desired. During active acne treatment, you might use multiple actives, but once clear, you can often maintain clarity with fewer products. For example, you might maintain clear skin using just retinoid at night and benzoyl peroxide spot treatments as needed, dropping the salicylic acid cleanser you used initially. Experiment to find the minimum effective routine for your skin. Monitor your skin monthly for early signs of breakout. Catching pimples at the very first sign and treating them aggressively prevents them from developing fully. Many people can prevent significant breakouts through early intervention with spot treatments when they notice the first small bumps. Keep your skincare routine on hand. Never run out of your essential treatments. Having spare bottles ensures you never skip treatments due to product unavailability. Some people order backup products when their current product is half empty, ensuring continuity. Identify your acne triggers through your skincare journal. Did acne worsen during stressful periods? After consuming certain foods? During certain times of your menstrual cycle? After skipping your routine? After trying new products? Understanding your personal triggers allows you to implement preventative strategies. If you identify stress as a trigger, prioritize stress management. If certain foods worsen acne, avoid them. If hormonal cycling causes breakouts, prepare in advance with more aggressive treatment during high-risk times. Seasonal adjustments may be necessary. Some people experience worse acne in summer, increased heat, humidity, sun exposure, or winter, dry air, heating systems. Adjust your routine seasonally, perhaps more frequent use of oil control treatments in summer, more aggressive moisturizing in winter. This flexibility maintains clear skin year-round. Maintain the lifestyle habits that support clear skin. Continue stress management, adequate sleep, regular exercise, healthy diet, and hydration. Don't revert to poor habits thinking your clear skin is permanent and won't be affected. Lifestyle factors remain important indefinitely. Schedule regular dermatology visits even after achieving clear skin. Annual checkups allow your dermatologist to assess your maintenance routine, adjust treatment if necessary, and catch any skin concerns early. Regular professional oversight prevents complications and ensures your long-term skin health. Handle occasional breakouts strategically. Everyone experiences occasional breakouts despite perfect routines, a particularly stressful period, new product irritation, or unknown trigger can cause isolated pimples. Treat these immediately with appropriate spot treatments. Don't allow occasional breakouts to discourage you into abandoning your routine. If you notice increasing breakouts despite consistent routine, assess what has changed. New products? Increased stress? Inflammatory effects. Many people, particularly those in northern climates or those who avoid sun exposure, have vitamin D deficiency. Supplementing vitamin D at 1000 to 400 IU daily improves acne in some individuals, particularly those with low baseline levels. Testing vitamin D status can help identify deficiency. Selenium deficiency affects immune function and skin health. Adequate selenium, 55 to 200 micrograms daily, supports skin health. However, acne-specific benefits of selenium supplementation aren't definitively established. Iron deficiency, particularly in menstruating women, can affect overall skin health and healing. Severe iron deficiency anemia causes various health problems including poor wound healing and immune dysfunction. However, iron supplementation for non-deficient people doesn't improve acne. Vitamin A, retinol, deficiency causes follicular hyperkeratinization and immune dysfunction contributing to acne. However, toxicity from excess vitamin A is also problematic. Getting adequate vitamin A through diet, liver, sweet potato, leafy greens, is ideal. Supplementing vitamin A is only necessary if deficient. B vitamins, particularly B5, pantothenic acid, are promoted for acne at very high doses, 10 plus grams daily. However, evidence is weak and high-dose B5 causes diarrhea frequently. Normal B vitamin intake through diet or multivitamin supplementation supports general health without special acne benefits. Omega-3 fatty acid deficiency promotes systemic inflammation worsening acne. Getting adequate omega-3s, 1 to 2 grams EPA plus DHA daily from fish or supplements, supports skin health through inflammation reduction. Identifying nutritional deficiencies, blood testing can assess status for most nutrients. Dietary assessment helps identify if diet provides adequate nutrients, considering supplementation if deficiencies are identified. However, supplementing without deficiency rarely provides additional benefit. Getting nutrients through food when possible is preferable to supplementation. Guide 56, Occupational Acne Syndromes, Tar acne, Oil acne, and Chemical exposure. Workers in certain occupations experience acne specifically from occupational chemical exposures. Understanding occupational acne helps you implement prevention strategies and pursue appropriate treatment. Tar acne develops in workers exposed to coal tar, crude oil, and petroleum products. Mechanics, road workers, and petroleum industry workers are susceptible. Tar acne results from follicular occlusion and irritation from these substances. Appearance is often on exposed areas, hands, face, neck, forearms. Oil acne develops in workers exposed to mineral oils and cutting fluids in metalworking, automotive work, and similar occupations. These oils are comedogenic and occlusive, clogging pores and promoting acne. Oil acne is often quite severe if exposure is chronic. Chloracne results from exposure to chlorinated hydrocarbons in chemical manufacturing. This is rare but when occurs, is severe. Chloracne is characterized by cystic acne and systemic symptoms from toxic chemical exposure. Prevention strategies for occupational acne include wearing protective equipment, gloves, long sleeves, face protection when possible, washing thoroughly at end of work shifts to remove chemicals from skin, changing out of contaminated clothing immediately, using workplace-provided safety measures and equipment, discussing with employers if exposures can be reduced or if different equipment can minimize exposure. Treating occupational acne while reducing exposures through workplace modifications is important. Standard acne treatments combined with occupational hygiene improvements provide best results. Workplace legal considerations matter if acne results from unsafe occupational exposures. In some jurisdictions, occupational skin diseases are covered under workers' compensation. Documenting occupational exposure history and acne onset can establish occupational causation. Guide 57, Asian Skin, Rosacea, and Acne in East Asian Populations. East Asian skin has specific characteristics affecting acne presentation and treatment response. Understanding these characteristics improves acne management in East Asian populations. East Asian skin often has different lipid composition and barrier characteristics compared to other populations. Some evidence suggests East Asian skin has higher ceramide content but different lipid organization, affecting both barrier function and acne development. Rosacea is increasingly recognized in East Asian populations, though historically was underdiagnosed. East Asian rosacea often presents as acne-like lesions, acne rosacea, potentially confused with bacterial acne. Recognizing rosacea as distinct from acne ensures appropriate treatment selection. Sebaceous gland characteristics may differ slightly across ethnic backgrounds, though individual variation exceeds group variation. Treatment intensity might require individualization based on individual skin characteristics rather than ethnic background. Post-inflammatory hyperpigmentation is very common in East Asian skin and requires aggressive prevention and treatment. Sun protection is particularly important. PIH treatments, vitamin C, azelaic acid, hydroquinone, are particularly relevant. Barrier function support might be particularly important for East Asian skin in certain climates. Adapting treatment intensity and moisturizing based on individual response rather than population averages is most accurate approach. Guide 58, Acne in LGBTQ+ populations, hormone therapy and transition-related acne. Transgender and non-binary individuals receiving hormone therapy often experience acne changes related to hormonal transition. Understanding these changes helps manage acne during transition. Testosterone-based hormone therapy, for transmasculine individuals, typically worsens acne initially due to increased androgens. Acne often develops or significantly worsens during the first 1 to 2 years of testosterone therapy. This is particularly challenging for individuals already prone to acne. Aggressive acne prevention and treatment during testosterone initiation is important. Some individuals benefit from starting acne treatment prophylactically before or as testosterone therapy begins. Estrogen-based hormone therapy, for transfeminine individuals, typically improves acne over time as androgens are suppressed. Many transfeminine individuals experience significant acne improvement within several months to a year of estrogen therapy. This improvement can be dramatic and psychologically significant. Spironolactone, commonly used alongside estrogen therapy for anti-androgen effects, has acne-beneficial effects. The combination of spironolactone plus estrogen provides maximal acne improvement in transfeminine individuals. Timeline for hormone therapy acne effects is important to understand. Acne worsening from testosterone therapy might persist 1 to 2 years before stabilizing or improving. Setting realistic expectations prevents discouragement during this period. Psychological impact of acne during transition deserves acknowledgement. Acne during transition, when someone is often already managing significant life changes and body image adjustments, can cause additional distress. Aggressive acne management acknowledges this psychological weight. Working with dermatologists and endocrinologists familiar with transgender health improves care. Some clinicians are specifically experienced in managing acne in hormone therapy contexts. Guide 59, Acne Prevention in Acne-Prone Individuals, True Primary Prevention. True primary prevention prevents acne from developing in susceptible individuals before breakouts occur. While this doesn't apply to those already experiencing acne, understanding prevention helps younger individuals or those with family history prevent severe acne. Risk factors for developing acne include family history, strong genetic component, male sex, higher baseline androgens, and adolescent/young adult age. Individuals with all three risk factors have highest acne development risk. Primary prevention strategies include skincare routines starting in early adolescence, gentle cleansing, sun protection, use of non-comedogenic products, education about acne triggers and prevention, stress management techniques learned early, healthy diet emphasizing whole foods, adequate sleep, limiting skin trauma, not picking at skin, avoiding aggressive products. non-comedogenic product selection starting early prevents product-induced acne. Teaching teenagers to evaluate skincare products and cosmetics prevents years of unnecessary acne from products. Early intervention at first signs of acne prevents progression to severe acne. Starting mild treatments, salicylic acid cleanser, at the very first breakout often prevents acne from worsening. This early treatment is simpler than treating established severe acne. Preventing antibiotic resistance through early intervention with non-antibiotic treatments preserves antibiotic effectiveness if future antibiotics are needed. Starting with topical treatments rather than immediately jumping to oral understanding gut-skin axis mechanisms and implementing strategies to support gut health offers another angle for acne management. The gut microbiome, the trillions of bacteria colonizing your digestive tract, influences systemic health including skin health. A healthy microbiome supports immune function, intestinal barrier integrity, nutrient absorption, and inflammation regulation. Microbiome dysbiosis, imbalanced bacterial composition, contributes to systemic inflammation, impaired immune function, and intestinal permeability, leaky gut, all of which correlate with worse acne. Several mechanisms link gut dysbiosis to acne. First, dysbiosis allows pathogenic bacteria to proliferate, producing lipopolysaccharides that trigger systemic inflammation. This systemic inflammation worsens acne. Second, dysbiosis compromises intestinal barrier integrity, allowing bacterial lipopolysaccharides and undigested proteins to enter circulation, further triggering inflammation and activating immune responses. Third, dysbiosis impairs production of short-chain fatty acids, butyrate, that support intestinal and immune health. Fourth, dysbiosis impairs estrogen metabolism in the gut, potentially contributing to hormonal acne in women. Several dietary factors contribute to dysbiosis. Excess sugar promotes pathogenic bacteria growth. Processed foods low in fiber and high in additives promote dysbiosis. Insufficient fiber intake results in inadequate short-chain fatty acid production. Excessive omega-6 polyunsaturated fat relative to omega-3 PUFA promotes inflammatory bacteria. Chronic stress, sleep deprivation, and certain medications, particularly antibiotics, also contribute to dysbiosis. Supporting gut health involves dietary modifications. Increasing fiber intake through whole grains, vegetables, legumes, and fruits promotes beneficial bacteria that produce short-chain fatty acids. Increasing omega-3 fatty acids relative to omega-6, eating more fish, walnuts, seeds, reducing processed food, supports beneficial bacteria. Consuming prebiotic foods, foods that feed beneficial bacteria, like asparagus, onions, garlic, and resistant starch supports beneficial bacteria growth. Fermented foods containing live bacteria provide probiotics supporting gut health. Yogurt, kimchi, sauerkraut, miso, tempeh, and kombucha all contain beneficial bacteria. Regular consumption of fermented foods supports diverse microbiota. However, benefits are modest compared to overall diet quality and should supplement rather than replace dietary improvements. Probiotic supplements provide concentrated bacteria claimed to support microbiota. However, evidence for probiotic efficacy is mixed and varying. Some people benefit noticeably from specific probiotic strains, while others see no benefit. If interested in probiotics, choosing high-quality products with documented effective strains, like Lactobacillus and Bifidobacterium species, and consulting your healthcare provider is reasonable. Probiotics for acne-specific benefit remain researched, not definitively proven. Avoiding unnecessary antibiotics protects microbiota. When antibiotics are necessary for infection, taking them is appropriate. However, demanding antibiotics for viral infections, which antibiotics don't treat, harms your microbiota unnecessarily. Using antibiotics only when truly needed protects long-term microbiota health. Managing stress supports microbiota health. Stress promotes dysbiosis through multiple mechanisms. Implementing stress management supports both gut and skin health through this mechanism. Adequate sleep supports microbiota health and is one of the highest impact microbiota interventions available. Most microbiota disruption occurs with sleep deprivation. Prioritizing 7 to 9 hours nightly supports microbiota health. Exercise supports beneficial microbiota diversity. Regular exercise promotes beneficial bacteria growth independently of diet. This is one of the many benefits of consistent exercise. Alcohol, particularly excessive consumption, harms microbiota. While occasional moderate alcohol consumption probably has minimal microbiota effects, chronic excess consumption disrupts microbiota significantly. Smoking harms microbiota, contributing another mechanism through which smoking worsens acne. Implications for acne management. While microbiota science is still emerging, supporting gut health through diet, fiber, whole foods, limited sugar, omega-3 support, probiotics potentially, though evidence is mixed, stress management, sleep, and exercise likely support skin health through multiple mechanisms including microbiota effects. These interventions support overall health beyond just acne, making them worthwhile even though direct acne benefit is still being researched. Guide 37, Hormonal Testing, Evaluation, and When to Pursue Endocrine Assessment for Acne. For women with hormonal acne, pursuing endocrine evaluation can identify underlying hormonal imbalances enabling targeted treatment. Understanding when hormonal testing is appropriate, which tests are relevant, and how to interpret results guides effective management. Hormonal acne patterns suggest hormonal involvement warranting evaluation. Acne appearing primarily on the jawline and chin, concentrated in the lower face, often indicates hormonal acne. Acne worsening cyclically around menstrual periods strongly suggests hormonal involvement. Adult acne onset, particularly after the teenage years, is often hormonal. Acne resistant to standard topical treatments, particularly if inflammatory and deep, often reflects hormonal causes. Women with other hormonal symptoms, irregular periods, excessive hair growth, hair loss, fertility issues, should definitely pursue hormonal evaluation. Primary hormone involved in acne is androgen, particularly testosterone and DHT, dihydrotestosterone. However, most women with hormonal acne have normal total testosterone levels but exhibit heightened skin sensitivity to androgens. This explains why some women with normal hormones still have significant hormonal acne. It's about skin sensitivity, not absolute hormone levels. Relevant hormonal tests for acne evaluation include total testosterone, free testosterone, calculated or direct measurement, DHT, dihydrotestosterone, DHAS, dehydroepiandrosterone sulfate, LH, luteinizing hormone, FSH, follicle-stimulating hormone, and androstenedione. These tests assess androgen status and ovulatory function. Additionally, tests for other hormones affecting acne include estradiol, progesterone, tested in luteal phase for ovulation confirmation, cortisol, for stress-related endocrine effects, and thyroid function, TSH, free T4, may be relevant. Ovulatory dysfunction, present in conditions like PCOS, contributes to hormonal acne. PCOS involves elevated androgen production, irregular ovulation, and insulin resistance. Women with PCOS typically have irregular periods, acne, hirsutism, excessive hair growth, androgenetic alopecia, pattern hair loss, and often obesity. Testing for PCOS is appropriate for women with these symptoms. PCOS diagnosis requires ovulatory dysfunction, irregular periods, plus hyperandrogenism, elevated androgens or clinical signs, and/or polycystic 2 to 3 times weekly. After allowing this to dry, wait 10 to 20 minutes, apply your moisturizer. If using retinoids, apply them now, after at least 2 to 3 weeks of tolerance building. Optional, apply occlusive oil or balm as final step if your skin is dry. Step 7. Plan your treatment introduction sequence. Never introduce multiple new treatments simultaneously. Introduce your first active treatment, perhaps salicylic acid, use it 2 to 3 times weekly for 3 to 4 weeks, then reassess. If tolerating well and seeing some improvement, after 4 weeks consider introducing a second active, perhaps benzoyl peroxide on different days/times. Build your routine gradually over 8 to 12 weeks. This patience is rewarded with better long-term results than aggressive starting. Step 8. Plan adjustments based on response. After 8 to 12 weeks of consistent treatment, reassess. Is acne improving? Are side effects manageable? Do you need to increase treatment intensity? Based on your assessment, you might increase frequency of treatments, increase concentration, add another treatment, or make other adjustments. However, only adjust one variable at a time so you know what caused any changes. Step 9. Incorporate lifestyle factors. Alongside your skincare routine, implement dietary changes, reduce sugar, increase antioxidants, perhaps reduce dairy. Prioritize sleep, 7 to 9 hours nightly. Implement stress management, meditation, exercise, or your preferred method. These factors take 4 to 8 weeks to show skin effects but provide significant benefits. Step 10. Plan professional treatments if appropriate. If after 12 weeks of diligent home care your acne hasn't adequately improved, consider professional treatments like chemical peels, laser, or blue light therapy. Monthly professional treatments combined with home care often produce better results than home care alone for moderate to severe acne. Step 11. Plan long-term maintenance. Once your acne clears, identify which treatments were essential for your success and continue them at maintenance levels. Your maintenance routine might be simpler than your treatment routine, perhaps just retinoid at night and sunscreen during the day, but it should continue indefinitely to prevent acne recurrence. Step 12. Build flexibility for adjustments. Your perfect routine isn't static. Seasonal changes, life stress changes, hormonal cycles, and other factors might necessitate routine adjustments. Have a plan for intensifying treatment during high-risk times, increased stress, menstrual cycle high-risk phase. Be willing to adjust your routine based on your skin's response rather than rigidly sticking to something not working. a sample personalized routine for moderate inflammatory acne might look like. Morning, gentle cleanser niacinamide serum, optional, lightweight moisturizer SPF 30+ sunscreen. Evening, makeup removal if applicable gentle cleanser hydrating toner/essence, optional, benzoyl peroxide 2.5%, 3 to 4 times weekly initially, moisturizer optional, retinoid, starting 2 to 3 times weekly after tolerance built. Lifestyle, 7 to 9 hours sleep, 30 minutes exercise 5 times weekly, stress management, diet emphasizing whole foods with reduced sugar. Professional, monthly superficial chemical peels if available. Timeline, 8 to 12 weeks for significant improvement, 6 months for near-complete clarity. This framework is meant as guidance, not prescription. Your perfect routine will be unique to your specific acne type, skin characteristics, lifestyle, and preferences. The principle is starting conservatively, progressing gradually, incorporating evidence-based treatments, addressing lifestyle factors, and maintaining long-term consistency. This approach works because it respects your individual skin while following scientific principles of acne treatment. Remember, there's no single, best, acne treatment. There's only the best treatment for your individual skin. Finding that treatment requires some experimentation, patience, and willingness to adjust based on results. Most acne responds to consistent, appropriate treatment. Your clear skin is achievable with the right approach for you specifically. The ultimate lesson: acne is treatable. Whether your path involves topical treatments, professional treatments, hormonal interventions, or isotretinoin, solutions exist for your specific acne. Finding the right approach for your individual situation, maintaining patience and consistency, and persisting through initial difficulties leads to clear, healthy skin. Your acne journey is unique, but clear skin is absolutely achievable. # 20 Expert Level Skin Care and Acne Treatment Guides, Part 3. Each guide, 10 to 15 minutes reading time. Guide 31, Acne Scar Treatments, Comprehensive Guide to All Scar Types and Advanced Therapy Options. Acne scars represent permanent reminders of severe acne, but modern dermatology offers numerous treatment options that can significantly improve scarring. Understanding different scar types, appropriate treatments, realistic outcomes, and combination approaches enables you to effectively address post-acne scarring. Acne scars exist in 3 primary morphologies, each requiring different treatment approaches. Ice pick scars are deep, narrow indentations resembling puncture wounds from an ice pick. These scars have sharp edges and typically measure 1 to 4 mm in diameter but penetrate deeply into the dermis. Ice pick scars are difficult to treat because their narrow base makes many standard treatments ineffective. Boxcar scars are wider depressions with relatively flat bottoms and sharp, vertical edges. These scars typically measure 4 to 6 mm or larger in diameter. Boxcar scars appear similar to chickenpox scars. Rolling scars are shallow depressions with sloping, rounded edges creating a wave-like appearance across the skin. Rolling scars often appear worse when skin is stretched due to their tethered nature. Understanding scar depth and type guides treatment selection. Shallow scars are often more responsive to surface treatments, while deep scars require deeper penetrating treatments. Mixed scar types within the same individual require combination approaches. Prevention remains the gold standard scar treatment. Avoiding picking, squeezing, or extracting acne prevents scarring. Treating acne aggressively to minimize deep inflammation prevents scarring. For anyone prone to severe acne, considering isotretinoin to prevent scarring is appropriate if acne is severe enough to cause scarring risk. For existing scars, numerous treatments provide varying degrees of improvement. Topical treatments are largely ineffective for true scarring, as scarring involves structural collagen loss that topical products cannot reverse. However, treating associated hyperpigmentation with topical treatments makes scars less noticeable. Subcision is a minor surgical procedure particularly effective for rolling and tethered scars. A needle or small scalpel is inserted under the scar, severing fibrous tissue anchoring the scar to deeper structures. This allows the scar to elevate as new collagen forms underneath. Subcision often requires multiple treatments performed weeks apart. Results develop over months as new collagen remodels. Subcision combined with other.
Welcome, and take a moment to breathe. Let yourself settle into this peaceful space where we'll explore together how to choose a moisturizer that truly serves your skin. There's no rush, no pressure, just gentle guidance as we navigate this essential aspect of skincare. Moisturizer is perhaps the most important product in your skincare routine. It doesn't matter if you have dry skin, oily skin, or anything in between. Every skin type needs and benefits from proper moisturization. Yet choosing the right moisturizer can feel overwhelming when you're faced with endless options, conflicting advice, and marketing claims that promise miracles. Let's start by understanding what moisturizer actually does and why your skin needs it. Your skin is constantly losing water through a process called transepidermal water loss. Water evaporates from the deeper layers of your skin through the outer layer and into the environment. This is a natural, unavoidable process, but when you lose too much water, your skin becomes dehydrated, compromised, and unable to function optimally. A good moisturizer does two essential things. It delivers hydration to your skin, and it helps prevent water loss by creating a protective barrier. Think of it as both giving your skin a drink and putting a lid on the glass so the water doesn't evaporate away. When your skin is properly moisturized, it's comfortable, resilient, and better able to protect itself from irritation and environmental stress. When your skin is dehydrated, it becomes sensitive, dull, and more prone to all kinds of concerns, even excessive oil production, which might seem counterintuitive, but is actually your skin's way of trying to compensate for lack of moisture. Now let's talk about the different types of moisturizers and how to understand which might be right for you. Moisturizers generally fall into three categories based on their primary ingredients: humectants, emollients, and occlusives. A good moisturizer usually contains a combination of all three, but in different proportions depending on what your skin needs. Humectants are ingredients that attract water. They draw moisture from the environment and from the deeper layers of your skin up to the surface. Common humectants include hyaluronic acid, glycerin, and aloe vera. These ingredients are wonderful for hydration, but they work best when sealed in with other ingredients. In very dry environments, humectants alone can actually draw too much water from your skin, so they need to be paired with occlusives. Emollients are ingredients that soften and smooth your skin. They fill in the gaps between skin cells, making your skin feel silky and look more refined. Common emollients include plant oils, shea butter, and various fatty acids. Emollients make your skin feel comfortable and help repair the skin barrier. Occlusives are ingredients that create a physical barrier on your skin's surface to prevent water loss. They're like a protective seal. Common occlusives include petrolatum, dimethicone, and various waxes. While occlusives can feel heavy, they're incredibly effective at locking in moisture, especially for very dry skin. Understanding these categories helps you read ingredient lists and understand what a moisturizer will do. But you don't need to become a cosmetic chemist to choose a good moisturizer. You just need to understand your skin's needs and how different moisturizer textures typically perform. Let's talk about moisturizer textures and formulations. Gel moisturizers are lightweight and water-based. They absorb quickly and don't leave a heavy feeling on the skin. Gels are often preferred by people with oily or acne-prone skin, or those who live in hot, humid climates. They typically contain more humectants and fewer occlusives. Gel moisturizers are refreshing and comfortable, but they may not provide enough moisture for very dry skin or harsh weather conditions. Lotion moisturizers are liquid and lightweight, but contain more emollients than gels. They spread easily and absorb well without feeling too heavy. Lotions work well for normal to slightly dry skin and are versatile across different seasons and climates. They provide good hydration without overwhelming the skin. Cream moisturizers are thicker and richer. They contain more emollients and occlusives, making them more nourishing and protective. Creams are ideal for dry skin, nighttime use, or harsh weather conditions. They take longer to absorb but provide deeper, longer-lasting moisturization. If you have oily skin, you might find creams too heavy for daytime use, but they could work beautifully at night. Ointments and balms are the heaviest, most occlusive options. They're primarily oil-based and create a strong protective barrier. These are best for extremely dry skin, damaged skin barriers, or specific areas that need extra protection, like lips or hands. Most people don't use these on their face except in cases of severe dryness or barrier damage. Now, how do you choose what's right for you? Start by honestly assessing your skin's current state. How does your skin feel throughout the day? Does it feel tight, especially after cleansing? Does it look flaky or rough? If so, your skin is likely dry and needs a richer moisturizer with more emollients and occlusives. Does your skin feel oily, especially by midday? Does it look shiny? If so, you might assume you don't need moisturizer, but that's often incorrect. Many people with oily skin are actually dehydrated, lacking water, not oil. Their skin produces excess oil trying to compensate for the lack of moisture. These skin types often benefit from lightweight, hydrating gel or lotion moisturizers. Does your skin feel different in different areas? Perhaps oily in your T-zone but dry on your cheeks? This is combination skin, and you have two options. Use one balanced moisturizer everywhere, or use different moisturizers in different zones. Most people find that one well-chosen moisturizer works fine for their entire face, but you can customize if needed. Consider your climate and environment. If you live somewhere hot and humid, lighter moisturizers usually work better. If you live somewhere cold and dry, or if you spend time in air-conditioned or heated spaces, you'll likely need richer moisturization. Your moisturizer needs might change with the seasons, lighter in summer, richer in winter. Think about when you'll be using the moisturizer. Morning moisturizers are often lighter because they need to sit well under sunscreen and makeup. Evening moisturizers can be richer because you don't need to worry about how they layer with other products or how they look. Some people use the same moisturizer morning and night, while others prefer different formulas. There's no wrong approach, just what works for you. Consider any specific skin concerns you're addressing. If you're dealing with acne, look for non-comedogenic moisturizers that won't clog pores. If you have sensitive or reactive skin, look for fragrance-free, minimal ingredient formulas. If you're concerned about aging, you might want a moisturizer with added antioxidants or peptides. Now let's talk about how to actually test if a moisturizer is working for you. When you try a new moisturizer, give it at least a week or two before deciding if it's right. Your skin needs time to adjust and respond. After applying the moisturizer, notice how your skin feels immediately. Does the moisturizer absorb comfortably, or does it sit on top of your skin feeling greasy? Does it sting or burn? Any stinging or burning is a red flag. That's not normal adjustment, that's irritation. Check how your skin feels an hour after application. Is it still comfortable, or does it feel tight again? If it feels tight quickly, the moisturizer isn't providing enough hydration or barrier protection for your needs. Notice how your skin feels at the end of the day. If you're constantly wanting to reapply moisturizer because your skin feels uncomfortable, the formula isn't right for you. If you applied it in the morning and your skin still feels comfortable in the afternoon, that's a good sign. Look at your skin in the mirror after a few days of consistent use. Does it look healthy and balanced, or does it look more congested, oily, or irritated? Your skin will tell you clearly if a product isn't working. Pay attention to welcome and take a moment to settle into this peaceful space. Breathe deeply and let go of any tension. Today we're going to explore one of skincare's most celebrated hydrating ingredients, hyaluronic acid. The name might sound intimidating. Acid can evoke thoughts of harsh, aggressive treatments. But hyaluronic acid is nothing like that. It's one of the gentlest, most hydrating ingredients you can use on your skin. In fact, it's already naturally present in your body, making it wonderfully compatible with your skin. Let's begin by understanding what hyaluronic acid actually is and why it's so remarkable. Hyaluronic acid is a molecule that your body naturally produces and uses in various tissues, including your skin, joints, and eyes. Its superpower is its ability to hold water, an astonishing amount of water. One molecule of hyaluronic acid can hold up to 1,000 times its weight in water. Imagine that. A single molecule acting like a tiny sponge, attracting and retaining moisture. In your skin, natural hyaluronic acid helps maintain hydration, plumpness, and suppleness. It fills the spaces between collagen and elastin fibers, creating a cushioned, hydrated environment where your skin cells can thrive. When your skin has adequate hyaluronic acid, it looks plump, smooth, and radiant. Unfortunately, as you age, your natural production of hyaluronic acid decreases. Starting in your 20s and accelerating through your 30s and beyond, your skin gradually produces less of this vital molecule. This is one reason why skin tends to look less plump and more dehydrated as we age. The good news? You can supplement your skin's hyaluronic acid through topical application, helping restore that youthful hydration and plumpness. Now let's talk about what hyaluronic acid does when you apply it to your skin. First and foremost, it's a humectant. Humectants are ingredients that attract water from their surroundings and bind it to your skin. When you apply hyaluronic acid, it draws moisture from the air and from deeper layers of your skin, bringing hydration to the surface where you can see and feel the benefits. This immediate hydrating effect is why hyaluronic acid feels so instantly gratifying. Within minutes of application, your skin feels more supple, looks more plump, and appears more radiant. This isn't just superficial. You're actually increasing the water content in your skin. Hydrated skin functions better in every way. When your skin cells are properly hydrated, they can carry out their normal processes more efficiently. Cell turnover improves, barrier function strengthens, and even oil production can normalize. Hydration is truly foundational to healthy skin. Second, hyaluronic acid helps reduce the appearance of fine lines and wrinkles. When your skin is dehydrated, fine lines become more prominent. Think of a plump grape versus a raisin. Both are the same fruit, but one has lost its water content and become wrinkled. By flooding your skin with hydration, hyaluronic acid temporarily plumps up those fine lines, making them less visible. This is especially noticeable around the eyes and mouth, where expression lines tend to form. While this effect is temporary, the hyaluronic acid must be reapplied regularly to maintain results. With consistent use, you can maintain that plumped, smooth appearance. Third, hyaluronic acid supports your skin barrier. A well-hydrated barrier is a strong barrier. When your skin is adequately hydrated, the lipids and cells that make up your barrier can arrange themselves properly, creating better protection against environmental stressors and reducing water loss. Think of your skin barrier like a brick wall. If the bricks are dry and brittle, the wall is weak. But if they're well maintained and properly moisturized, the wall is strong and protective. Hyaluronic acid helps keep those bricks in optimal condition. Fourth, hyaluronic acid has a soothing effect on the skin. While it's not specifically an anti-inflammatory ingredient, the act of deeply hydrating your skin can reduce irritation and discomfort. Dehydrated skin is often sensitive, tight, and uncomfortable. Restoring hydration naturally calms these sensations. Fifth, hyaluronic acid works for every skin type. Whether you have dry, oily, combination, sensitive, or mature skin, hyaluronic acid offers benefits. It's lightweight and non-greasy, making it perfect for oily skin. It provides deep hydration that dry skin desperately needs. It's gentle enough for sensitive skin, and it addresses the dehydration that comes with aging. This universal compatibility is one reason hyaluronic acid has become such a staple in skincare. It's rare to find an ingredient that truly works for everyone, but hyaluronic acid is one of them. Now, let's talk about molecular weight and why it matters when choosing hyaluronic acid products. Hyaluronic acid comes in different molecular sizes: high molecular weight, medium molecular weight, and low molecular weight. Each size has different properties and benefits. High molecular weight hyaluronic acid has large molecules that sit on top of your skin. They can't penetrate deeply, but they create a beautiful hydrating film on your skin's surface. This surface hydration feels immediately comfortable and helps prevent water loss. It's like placing a moisture-locking blanket over your skin. Low molecular weight hyaluronic acid has smaller molecules that can penetrate more deeply into your skin. They deliver hydration to deeper layers, providing more lasting effects and working from within to plump and hydrate. Many modern hyaluronic acid products use a blend of different molecular weights, giving you both immediate surface hydration and deeper, longer-lasting effects. This is ideal because you get the instant gratification of surface moisture, plus the cumulative benefits of deep hydration. When shopping for hyaluronic acid products, look for those that specify they use multiple molecular weights or list different forms like sodium hyaluronate, which is a salt form of hyaluronic acid with smaller molecular size. Let's discuss how to use hyaluronic acid effectively in your routine. Timing is important with hyaluronic acid because it's a humectant that draws water from its surroundings. You want to apply it when there's moisture available to draw. This means applying it to damp skin. After cleansing, while your skin is still slightly damp, is the perfect time to apply hyaluronic acid. That surface moisture gives the hyaluronic acid water to bind to. If you apply it to completely dry skin, it might actually draw water from deeper layers of your skin, which can be counterproductive. Some people like to mist their face with water or a hydrating toner before applying hyaluronic acid, then mist again after. This sandwich technique ensures there's plenty of water for the hyaluronic acid to grab onto. After applying hyaluronic acid, it's crucial to seal it in with a moisturizer. Remember, hyaluronic acid is a humectant, not an occlusive. It draws water to your skin, but doesn't prevent it from evaporating away. You need to lock in that hydration with a cream or lotion that contains occlusive ingredients. Think of it as filling a bucket with water, hyaluronic acid bringing hydration, and then putting a lid on it, moisturizer preventing evaporation. Both steps are necessary for optimal hydration. You can use hyaluronic acid both morning and night. It layers beautifully under sunscreen in the morning and under heavier night creams in the evening. Many people apply it after cleansing and toning, before serums and moisturizers. Hyaluronic acid is also available in different product types: serums, essences, moisturizers, and even sheet masks. Serums tend to have higher concentrations and allow for more precise layering with other products. Moisturizers with hyaluronic acid give you hydration and occlusion in one step, which is convenient. The concentration of hyaluronic acid in products typically ranges from 0.1% to 2%. You don't need extremely high concentrations to see benefits. Even lower percentages are effective when formulated properly. One important consideration: climate matters when using hyaluronic acid. In humid environments, Hyaluronic acid has plenty of water vapor in the air to draw from, making it extremely effective. But in very dry environments, think desert climates or heated indoor spaces in winter, there may not be enough moisture in the air for hyaluronic acid to bind. In these dry conditions, hyaluronic acid might draw water from deeper layers of your skin instead of the environment, potentially leading to increased dehydration. The solution is simple. Use a humidifier to add moisture to the air. Apply hyaluronic acid to damp skin with an occlusive moisturizer on top, or consider using it in combination with other hydrating ingredients that work differently. Are there any downsides to hyaluronic acid? Very few. It's extremely well tolerated, and allergic reactions are rare. Some people with very sensitive skin might react to certain formulations, but this is usually due to other ingredients in the product rather than the hyaluronic acid itself. One thing to be aware of: some lower quality hyaluronic acid products can feel sticky or pill up under other products. This is usually a formulation issue, not a problem with hyaluronic acid itself. If you find your product feels uncomfortable, try a different brand. Hyaluronic acid also works beautifully with other ingredients. It's compatible with virtually everything: vitamin C, retinol, niacinamide, AHAs, BHAs. It can actually help buffer potentially irritating ingredients, making them more tolerable. Let's address some common questions about hyaluronic acid. Can you use too much? Not really. Your skin will absorb what it can use and the rest will sit in the surface, which isn't harmful. However, layering multiple hyaluronic acid products may be redundant. One good serum is usually sufficient. Does it work immediately? You'll notice surface hydration almost instantly. Your skin will feel more supple and look more dewy within minutes. However, deeper, more significant improvements in skin texture and fine lines require consistent use over several weeks. Can it replace moisturizer? No. Hyaluronic acid is a hydrator, not a moisturizer. Hydration refers to water content, while moisturizing refers to preventing water loss and replenishing lipids. You need both for optimal skin health. Is it safe during pregnancy? Yes, hyaluronic acid is considered safe during pregnancy and breastfeeding. It's a naturally occurring substance in the body, and topical application poses no known risks. As we close our time together, remember that hyaluronic acid is one of skincare's true heroes. A gentle, effective, universal ingredient that simply helps your skin do what it already wants to do: stay hydrated, plump, and healthy. It doesn't force dramatic changes or cause irritation. It simply supplements what your skin naturally has but loses over time. This is skincare at its best, working with your body, not against it. Take a deep breath in and release it slowly. Consider how you might incorporate hyaluronic acid into your routine, or if you're already using it, appreciate the gift of hydration it's giving your skin. May your skin be deeply hydrated, plump, and radiant. May you choose ingredients that truly nourish and support you. May you find joy in this simple act of care. Thank you for this time together. Be well and be gentle with yourself.
Dietary modifications might help cyclical acne through hormone metabolism. Some evidence suggests that supporting liver health through adequate nutrients supports estrogen metabolism. Consuming adequate B vitamins, magnesium, and fiber supports hormone metabolism. PMS supplements containing ingredients like calcium, magnesium, and vitamin B6 might help with luteal phase acne through their effects on hormone metabolism and inflammation. Some women find these supplements modestly helpful. Stress during the luteal phase exacerbates acne in many women. The luteal phase naturally involves slightly increased anxiety and mood sensitivity. Implementing additional stress management during this phase, extra exercise, meditation, or relaxation practices, can reduce acne by controlling stress hormonal interactions. Sleep quality often decreases in the luteal phase due to progesterone effects. Prioritizing sleep during this phase through good sleep hygiene, potentially with earlier bedtimes, supports skin health. Understanding your cyclical acne pattern allows realistic expectations and strategic planning. Rather than being frustrated by predictable breakouts, you can anticipate them and proactively manage them. This empowerment often improves both skin outcomes and psychological well-being around acne. Guide 52, Acne Cosmetica, Product-Induced Acne and Ingredient Avoidance. Acne cosmetica specifically refers to acne triggered or worsened by cosmetic products. Understanding this condition and identifying problematic ingredients prevents wasted time and money on ineffective acne treatments when the actual problem is product-induced acne. Acne cosmetica differs from typical acne in that stopping the offending product often resolves it completely, whereas typical acne persists despite good skin care. This distinction is diagnostically important. If your acne improves dramatically after discontinuing a specific product, acne cosmetica was likely the cause. Common culprits in acne cosmetica include foundations, particularly heavy, silicone-based ones, primers, concealer, powders, sunscreen, and heavy moisturizers. These products can clog pores through their occlusive nature or irritating ingredients. Specific ingredients commonly triggering acne cosmetica include dimethicone, silicone oil, talc, isopropyl myristate, emollient, and certain botanical extracts that are irritating to acne-prone skin. Coconut oil, for example, is comedogenic for many acne-prone individuals despite being natural. Testing for acne cosmetica involves systematic elimination. If you suspect a product is causing acne, stop using it for 2 to 3 weeks and assess whether your acne improves. If it does, the product was likely responsible. Then reintroduce the product to confirm, though this re-triggers acne and can be frustrating. This elimination challenge approach definitively identifies culprit products. Non-comedogenic labeling helps identify acne-safe products, though labeling is not FDA regulated and varying definitions exist across brands. Non-comedogenic products are still not guaranteed safe for all individuals, but they're formulated to minimize pore clogging risk. For confirmed acne cosmetica, switching to acne-safe alternatives of the product category often resolves the issue. Switching to non-comedogenic foundations, powder-based makeup instead of cream-based, or lighter formulations often allows makeup use without acne worsening. Reading ingredient lists helps identify potentially problematic components. Becoming familiar with ingredients triggering your personal acne helps you avoid them. Some people maintain lists of problematic ingredients to check against when considering new products. Patch testing new products on a small area, behind your ear or on your jaw, before full-face application helps identify problematic products before they cause widespread acne. This 1 to 2 week trial prevents wasting money on products that trigger acne. The relationship between acne cosmetica and other acne factors is important. Someone might have both hormonal acne, from internal factors, and acne cosmetica, from products. Addressing both simultaneously, using acne-safe products plus treating hormonal acne medically, provides the best outcomes. Makeup artists and dermatologists can recommend acne-safe product alternatives for people who require makeup professionally. Many professional-grade acne-safe makeup lines exist specifically for people needing makeup without triggering acne. Guide 53, Acne Mechanica, Friction and Pressure-Related Acne. Acne mechanica results from friction, pressure, or occlusion of skin and can be prevented through environmental and behavioral modifications. Understanding acne mechanica helps you prevent this preventable form of acne. Acne mechanica appears where friction or pressure occurs, under helmet straps, where backpack straps compress skin, where tight athletic equipment contacts skin, or where repetitive hand-face contact occurs. This acne is localized to pressure-bearing areas rather than distributed across the face. Friction from repetitive skin-on-surface contact, athletes rubbing faces on towels, workers constantly resting their faces on hands, can trigger acne through mechanical irritation and follicle disruption. Occlusion, trapping sweat and bacteria under non-breathable materials, creates ideal conditions for acne. Wearing tight, non-breathable clothing or equipment increases acne in that area. Prevention strategies include wearing loose, breathable clothing, ensuring athletic equipment is clean, using protective barriers, adhesive taping where possible, between skin and friction sources, and maintaining good hygiene in high-friction areas. Post-exercise hygiene is crucial for athletes. Showering immediately after exercise, changing into clean clothes, and cleansing areas where equipment contacted skin helps prevent friction acne. Some athletes find that using antiperspirant before exercise reduces sweat-related friction and bacterial growth. Hairstyles causing friction, tight braids, tight buns, can trigger acne on the scalp and forehead. Occasionally loosening hairstyles, using gentler hair-holding methods, or alternating hairstyles reduces friction acne. Phone contact with your face transfers bacteria and causes friction acne on the jawline and cheek. Using earbuds or speakerphone when possible, cleaning your phone screen regularly, and taking breaks from phone use reduce this contact-related acne. For occupational friction acne, workers in certain industries, workplace modifications and protective equipment prevent acne. Ensuring clean, breathable protective equipment and maintaining good hygiene at work helps control occupational friction acne. Acne mechanica is often preventable through simple environmental modifications. Unlike acne requiring medications, friction acne responds to preventing the friction. This makes acne mechanica particularly frustrating when it occurs since prevention is often simpler than treatment. Guide 54, Drug-Induced Acne and Medication Side Effects. Certain medications trigger or worsen acne as a side effect. Recognizing drug-induced acne allows you to work with prescribers to modify medications or manage acne while necessary medications are continued. Corticosteroids commonly trigger acne or worsen existing acne. Systemic corticosteroids, oral, are more likely to cause acne than topical steroids, though topical steroids applied to face can also trigger acne. Patients on chronic systemic corticosteroids often experience significant acne requiring aggressive treatment. If corticosteroids are necessary, combining them with acne treatment is often required. Lithium, used for bipolar disorder treatment, causes acne in many patients. The mechanism involves effects on follicular epithelium and sebaceous gland function. Acne from lithium is sometimes severe. Working with your psychiatrist on whether alternative mood stabilizers are possible, or combining lithium with aggressive acne treatment, might be necessary. Anabolic steroids cause severe acne in nearly everyone using them. Anabolic steroid use for performance enhancement causes acne that often requires isotretinoin for management. The acne is typically severe, widespread, and on the trunk as well as face. Hormonal contraceptives can either improve or worsen acne depending on the specific formulation. Progestins with androgenic properties, like levonorgestrel or norgestrel, might worsen acne, while progestins with minimal androgenic activity, like norgestimate or drospirenone, often improve acne. If birth control is worsening acne, switching to a formulation with less androgenic progestin often helps. Anti-seizure medications sometimes worsen acne through various mechanisms. Working with your neurologist if seizure medications are worsening acne might identify alternatives or necessitate aggressive acne management. Vitamin B12 supplementation can paradoxically worsen acne in some individuals through unknown mechanisms. If you take B12 supplements and notice acne worsening, discontinuing B12 might help. Iodine-containing supplements or medications can trigger acne. High-dose iodine supplementation is associated with acne worsening. This is one reason avoiding excessive iodine supplementation unless specifically indicated is prudent. Phenytoin, anti-seizure medication, and other older anti-seizure drugs can trigger acne or gingival hyperplasia, gum overgrowth. If these medications are necessary, managing side effects is required. When drug-induced acne is suspected, first confirm with your prescribing healthcare provider that the medication is likely the culprit. Assess whether alternative medications without acne side effects exist. If alternatives don't exist, combine the medication with aggressive acne treatment. Don't discontinue necessary medications without medical guidance even if acne worsens. Guide 55, Nutritional Deficiencies and Acne, Zinc, Vitamin D, Selenium, and beyond. Certain nutritional deficiencies correlate with worse acne. Understanding which deficiencies affect acne allows you to assess your nutritional status and supplement if needed. Zinc deficiency is well established as correlating with worse acne. Zinc supports immune function, wound healing, and inflammation regulation, all relevant to acne. People with zinc deficiency have notably worse acne. Supplementing adequate zinc, 30 mg daily, often improves acne significantly if deficiency exists. However, supplementing when not deficient provides minimal additional benefit. Identifying zinc deficiency involves blood testing. However, zinc blood levels don't always accurately reflect total body zinc stores, making interpretation complex. If you suspect zinc deficiency, discussing blood zinc testing with your healthcare provider is reasonable. Vitamin